industry to achieve a number of things, which will roll out as we implement this 3-year agreement. But as I said, you can also not talk about HIV or talk about sex work without actually talking about gender-based violence. So it's important that we also begin to see the relationship and the exposure that sex workers, especially those that are women, have in terms of gender-based violence and the different elements that constitutes the package, so that we are able to intervene when the need arises. Allow me to then request a message of support from Me Shilatlo, the regional representative of UNAIDS. Me.
Okay, I'm not seeing too much of the lighting here, so let me get my specs, just a minute.
While she gets her specs, extra added eyes to see, let me also say, Deputy President, the challenge about sex work also challenges what we think of each other as a nation. And how do we judge each other based on our moral values? And to what extent we impose each other's values on each other without being willing to engage. Me, you have the floor.
Thank you very much. Thank you very much, my sister, our honorable Director of Ceremonies. Let me, I have only 5 minutes. So in that 5 minutes, I'm going to skip a lot of protocol and recognize Your Excellency, the Deputy President of South Africa and Chairperson of SANAC, Cyril Ramaphosa, and all the dignitaries here present, representatives of civil society, those I like very much because I was born and bred in civil society, development partners, members of the United Nations family, friends, colleagues, and fellow sex workers. I got mine, so if you don't have yours, you have a problem. So make sure you get yours before you leave here. Yeah. Let me say, I bring you greetings from our Executive Director, Michel Sidibe, and he cannot be with you, but he sent a very good representative, and he congratulates the government of South Africa, especially the Deputy President and Honorable Joe Patla, for the launch of this groundbreaking plan, the National Sex Worker, the South African National Sex Worker Plan. Bakaitsu, this is a very, innovative thing. It is the first in Africa, and we need to therefore applaud the government of South Africa for this. As a regional director of 21 countries of Eastern and Southern Africa, this has been one of the things that I've been advocating about in our countries. And about 3 years ago, I was in Rwanda as they were reviewing the penal code. And the advocacy in Parliament was for me to try and convince the Parliament, most of whom are women, by the way, to try by all means to get rid of that very phrase in the penal code that criminalizes sex work. It wasn't an easy thing, but we were able to move in that quite a lot of the criminalizing sections, for example, the death penalty and all that, were removed, so that the advocacy has to go on. And the advocacy going on means that we as sex workers have to be involved, okay? When we say in legal reform, legal reform is a sebaka. And there is no way until legal reform. The programs, they have to continue. As civil society, I started the very first sex workers program in 1990 through Emma Mbasadi, funded by an NGO, But we didn't have to wait until the laws were changed. However, you need to work with society. Le thuse borre ba ba habo. Le bereke le society gore ba tlhaloganye, so that as the law, takes its course, we are then able to have solid laws. In short, let's say male thata ka monga lone. So let's kala robala. That's right. Let's kala robala. So allow me therefore to acknowledge and congratulate the SANAC, sex worker sector, which has worked hand in hand with government to see through this development plan. It is indeed a great example of community collaboration and a real, showing of that very phrase, airing nothing for us without us. Yeah, you were involved, and we want you to be involved all the way until we see this to the end. The multi-sectoral plan covers HIV prevention, treatment, care, as is already stated, and the needs in different contexts. And it outlines a core of packages, services, including PrEP. Now, PrEP, South Africa is the leader. It's already been talked about in a lot in the media, so I'm not going to go into detail in that, except for me, it's really a point of really advocacy among other countries, the other 21 countries, but also the other 53 countries of Africa, to say South Africa is leading the way. Copy, don't reinvent the wheel. Go ahead and implement. So we are really there. I want to reassure you of the ongoing support of UNAIDS to the government and the people of South Africa to ensure that no one is left behind as we work towards ending AIDS as a public health threat by 2030. Now, this is one of the ways, but we need to understand, of course, that gender inequality is the one that is fueling the epidemic in all our countries. Women, are still marginalized. And therefore, in this decade of the African woman, as declared by the African Union, I want to call upon all our leaders to ensure the removal of all forms of discrimination, all laws, norms, practices that discriminate against women to really be repealed, so that we know that our leaders are actually doing what? Following what they're saying. That's all. But South Africa definitely is demonstrating the energetic need to Africa and the world for needed work with sex workers. Ending the AIDS epidemic is not possible if we do not succeed in reducing transmission through sex work. Why? Because globally we have an extensive HIV epidemic among sex workers. About 15 million women in the world are engaged in sex work. 15 million. And I mean, it's probably even more. And HIV prevalence is up to 13.5 times higher than among female sex workers than all adult women. About 70,000 new infections occur among female sex workers, plus the 140,000 new infections among the clients. So we have to ensure that we end this epidemic. And I know the step one is right now. Somebody said, how do you finish an elephant? How do you eat an elephant? You start with one small bite. It's one bite at a time. And right now we are biting. Yes. So South Africa, as I said, is building a good foundation. There is need for integration into health services with appropriate training and support and decentralization, as well as good monitoring and evaluation to improve pre-exposure prophylaxis contribution. So, ladies and gentlemen, colleagues, let me conclude by congratulating again and thanking the Deputy President of South Africa and all national community leaders who are here present today, and to thank the partners who are supporting this. We have to make sure that the partners know that we are going to move forth, and that whatever it is that they're donating will not be put to waste. This is an exemplary partnership and collaboration, and itself, it demonstrates the significance of this plan and its demonstration. Therefore, through this cohesive approach, we should collectively make sure that sisonke remoho we close this gap and leave no one behind. Thank you.
Ke a leboga. When you look at your programs, we're going to have Usis Kohli next. Bring it a bit closer to home, but allow me to take this opportunity to tender the apology of Deputy Minister Jeffries. He arrived yesterday from Switzerland and has a very, very bad flu. So he could not fly due to the pressure. So we sincerely wish to tender his apology. But allow me to just say a few words, because me and him tend to work together on these issues. Firstly, you would remember at the first engagement that we had together, we explained, one, that the Law Reform Commission has submitted the report on the issues around the processes and how we should go about in terms of getting to whether we decriminalize or legalize, whatever the outcomes would be as we enter into engagement. The Ministry of Justice and Corrections have received the report. We're beginning to engage because the report talks to multiple departments, including social development. So we are at the process of processing the report internally as government. And I can confirm that once the lead ministries, which is health, social development, and justice, have actually finalized the processes, and we will then ensure that the report is released to the public for public engagement, and that will not be done at the total exclusion of those that matters most, which is yourselves. So the Department of Justice will then implement, they will host a seminar to engage with yourselves to live up to nothing about us without us. So before we make it public, we will engage the sector and ensure that the sector is able to understand. Now, the last time we were together, having had the honor and privilege of being in Parliament for a very, very long time, I said to yourselves and to ourselves together that one of the things we could learn is from other sectors. Before I call Kohli, now that she is back, I want to say that we need to start by ensuring that we get to zero stigma, we get to zero discrimination. Now, Deputy President, a while ago, I think it was 2003-04, I was the chair of the Committee on Status of Youth, Children, and People with Disabilities in one of my deployments. And that was the first time I engaged with sweat then. It was in the early... And on a lighter note, as we were discussing the issues around sex work and all the challenges and frustrations, I never forget, one of the ladies said to me, you know, Deputy Minister, actually, comrades, all of us are actually sex workers. So I said to her, how young and Bella? I said, no, the difference is that some are prepaid and others are pay as you go. So in the spirit, Deputy President, of acknowledging that those that are married are prepaid and those that are not pay as you go, but we actually engage in the same activity called sex. With that, I shall allow me, Deputy President, as we would say, as I have now said, we are all in this together. Allow me to call the experts in the field. You know, in every profession there are experts. So allow me to call Kholi Buthelezi as an expert on sex matters to come and educate all of us. Thank you, Kholi.
Zonke izizwe sondelene. Wow. Thank you so much for that vuvum. And there are actually three. It's a contract, prepaid, pay as you go. So I think whilst you're sitting there, you should check yourself that you either you're on contract or pay as you go or prepaid. Can I just hear sex workers in the room saying, sex workers are safer sex? Expect. Sex workers are safer sex? Expect. Thank you so much. Thank you, Program Director. Ladies and gentlemen, allow me to convey my humble greetings to Honorable Deputy President of South Africa, Mr. Cyril Ramaphosa, ministers in the room, and the SANAC Chair, Steve Litsike, and the Chairperson of SANAC, Dr. Farid Abdul, and sex workers in the room, of course. It's about the day, it's about sex workers today, so it's a big day. I want to hear you say yes. Yes. Okay. Also to my humble greetings to civil society leaders and the implementing partners of the Red Umbrella Program, the stakeholders in the room, and all protocol observed. Today I would like to take this opportunity to just speak to you and stand in front of you speaking on behalf of the sex workers and representing Sisonke, sex worker movement in South Africa, the one and only. Today is a big day for us and Sisonke sex worker movement and sex workers in generally in the country. That the launch is taking place finally today, and it's an exciting moment that the day has come. We've been waiting for this day for so long. The day has come where services have been brought to sex workers. I would like to thank SANAC and Civil Society Forum for recognizing the sector, the sex worker sector within the Civil Society Forum. We wouldn't be here if it wasn't them. And not forgetting to thank the South African partners, the sub-recipient partners, and SWET for taking services to sex workers as well as peer educators in the room and the site coordinators in the room that are part and parcel of the Red Umbrella Fund Program Also to take this opportunity to acknowledge the technical working group for all the support throughout the process of the national plan and the sex worker technical working group. But I must say, as much as the healthy services and healthy issues has been tackled, we still feel that decriminalization of sex work should be in the agenda as an urgent matter. Within that said, let's all continue to enjoy and implement the program fruitfully. Just to highlight our role in the national plan as a sex worker sector, I think Farid has mentioned that earlier on. He did highlight that nothing about us without us. And our role in the plan was to participate and have input, as the plan is about sex workers and developed for sex workers. That is very important. And then the other thing that I'm wanting to highlight is that the latest that HIV in the national plan to offer, to reduce incidents and the negative healthy outcomes for key populations are peer education packaging, healthy care packages, psychosocial support services packaging, human rights, social capital building packaging, and economic empowerment packaging. I take this opportunity again to thank you and thank you all for the support.
Thank you very much, Koli. As we continue with our program, Deputy President Koli added others are on contract. So we need to look around and think who is on contract so we can all classify ourselves. But allow me to also say, Deputy President, that you really cannot talk about sex work, Deputy Minister of Health, in terms of the package of care, unless you acknowledge that sex workers are exposed and have a risk of cervical cancer. You cannot talk about a health package unless we also acknowledge that prostate and testicular cancer is part of the package. As we have pleasure and enjoy ourselves, we also need to be responsible, and sex workers have made that commitment. It is important for us as government to create an enabling environment for them to be able to be responsible. And you would be aware that our very capable SAPS sometimes makes it difficult for them to keep to their promises of responsible safe sex by confiscating their condoms, therefore disturbing their tools of the trade. So it is important that we all acknowledge that a condom is an inherent requirement of a sex worker's job. Let's make sure they have them. Thank you so much, Deputy Minister. You have the floor.
Thank you very much, Program Director, my colleague, Deputy Minister Bokopani Zulu, Deputy Minister of Social Development, His Excellency Deputy President Ramaphosa, our Regional Director for UNAIDS, Professor Sheila Tlow, who has already spoken to us, the Chairperson of SANAC Trust, Dr. Gwen Ramogopa, and the CEO, Dr. Farid Abdullah, Deputy Chairperson of SANAC, Mapaseka Litsike, our Acting Mayor of Johannesburg, Mayor Nonkeba Mulwele, members of the civic society who are here, members of the sex workers, civil society, and other civil society members here present, our distinguished guests, ladies and gentlemen, Sanbonani, Dumelang. Well, you never stop learning. Indeed, I've just learned a lot today from my colleague here, that indeed, as assembled here, we are all indeed sex workers. So we appreciate that clarification that there are those who are on contract and those who are on pay as you go. So indeed, we appreciate that lesson. My task here this afternoon at this very historic occasion in our fight against HIV and AIDS, especially in one of our key populations, on behalf of the Ministry and the Department of Health, and also on behalf of Minister Motsoaledi, who could not be here with us, it's really one of acknowledgement of the good work which has been done by the various sectors. I'm very pleased to be here with the Deputy President, who is indeed our champion in SANAC, in government, in terms of steering this program, and is not without a lot of his support that we are able to be launching this program here today. Research suggests that sex workers are part of key populations that are highly vulnerable to sexual and physical abuse, as well as substance abuse and HIV, as already mentioned by the program director. It is estimated, for example, that sex work contributes to between 6 and 20% of new HIV infections in South Africa, with prevalence of HIV in sex workers 3 times higher than in the general population. I think we have seen also from the presentation done by Farid earlier on. Therefore, this makes it imperative that we do everything that we can to prevent HIV transmission in sex workers. A program that provides health services to sex workers is good for the sex workers themselves, but beyond that, for them as individuals, but beyond that, also for their partners and families, and for society as a whole. Since 2009, we have significantly scaled up our HIV and TB programs. We have 3.4 million people on antiretroviral treatment, the largest program in the world. We have distributed millions of male and female condoms free of charge. We have strengthened our prevention of mother-to-child transmission program, with the result that we have decreased the transmission rate from 8% in 2008 to less than 1.5% as we speak. However, the battle is not yet won, and we need to focus on communities in our society that are still highly vulnerable to HIV acquisition. This is why South Africa has adopted the 1990 targets as proposed by UNAIDS for HIV. In addition, the Minister of Health has also proposed similar targets for TB, and this has now been accepted by all the players globally. So our approach to TB is also based on a 1990 approach. At the closing ceremony of the South African AIDS Conference in June last year in Durban, Minister Motsoaledi spoke passionately about the need to address the increased vulnerability and high risk of sex workers, and called for a national plan to address the needs of sex workers. Therefore, as the Department of Health, we are pleased that this event is taking place today in fulfillment of that. We are fully committed to ensuring that the plan that the Deputy President will be launching just a little bit later today is implemented in a comprehensive fashion, recognizing the importance of biomedical, psychosocial, structural, and human rights elements of our responses. In respect of the health package, the plan provides for all needs of sex workers, starting with basic need for reproductive health services, such as contraception, and the effective treatment of sexually transmitted infections. As you can imagine, contraception is an important element of the trade for sex workers to avoid unwanted pregnancies. In addition, the early diagnosis and treatment of sexually transmitted infections is important for sex workers, for their clients, as well as for their life partners. In addition to reproductive health and HIV treatment services. The plan being launched today also aims at ensuring that sex workers have the full package of health services needed, including continual supply of condoms, and we have had, as a program director has indicated, that part of the challenge here is that our colleagues on the other side of government, the members of South African Police Service, we have had the complaint that they often confiscate the condoms because they believe that this is an exhibit in terms of criminality. So that's a matter which we are addressing with the Minister and the Commissioner of Police. I'm sure we'll be able to solve that problem. Also, the treatment of related diseases such as tuberculosis, hepatitis, and access to the prevention of mother-to-child transmission as well. We will be expanding our health program, which Deputy President will highlight in the speech. But just to highlight, as already mentioned also by Professor Sheila Tlo, that one of those is pre-exposure prophylaxis. In other words, treatment before even the onset of infection. Also an approach of test and treat, which we also will be elaborated at a later stage. One of the issues that requires more attention is the destigmatization. I'm getting it right, destigmatization. The removal of stigma, because this also is an impediment, the stigma on sex work. Especially, we have heard your cry also from the gentleman who gave a poem, stroke speech, Leslie. We have heard that indeed sometimes the treatment you get from health facilities is not a very gentle one. So that's a matter which also with yourself we need to address on an ongoing basis. It is important that all health workers have a value-free approach when a sex worker needs health services. We will continue to work with all health workers to ensure that sex workers or any other marginalized community is not discriminated against in any way. With these remarks, ladies and gentlemen, now the program director is derailing me because I thought at this stage we're going to invite. Oh, you want to play first? Oh, okay. Ladies and gentlemen, on this note, this is our message from the Department of Health. The Deputy President will come at a later stage. I think there's still going to be some visual kind of feeding of our visual appetites. The people who are here about wants to show us something. So we're going to have that before we call upon the Deputy President. Thank you very much.
Thank you very much, Deputy Minister. I swapped the program around. That's the powers that program director have, because I wanted to make sure that before the Deputy President launch this very, very important program, and I want to say again, Deputy President, a condom for a sex worker that is responsible, it's a tool of the trade. So we need to protect and make sure they have tools of the trade. With that having said, allow me to now bring it closer to home and call upon those that are going to entertain us, make it real.
Ifuni condom. Let's condom. Messenger, ifuni condom. Ifuni condom. Let's condom. Siba talagune virus. Talagune virus. Let's condom. Talagune virus. Let's condom. Masenje. Let's condom. Masenje. Ifuni condom. Let's condom. Sibatala gune virus. Sibatala gune virus. Let's condom. Sibatala gune virus. Sibatala gune virus. Let's condom. Masenje. Let's condom. Funu condom. Funu condom. Let's condom. Sibatala gune virus. Sibatala gune virus. Let's condom. Sibatala gune condom. Sibatala gune virus. Let's condom. The new condom.
Hey, ebile manta ga ke tle tleliniking ke tlo bona batho ba khukegile. Ba reipilwe ke di gay ba tlotla mo tleliniking ke tlo ba bontsha tsatsi la mmege. Nte ke bone tsa mo tleliniking ke metlholo fela. Di ke nne busy ke bakanye dilo tsaka.
Hello.
Hey, Sisi.
How are you, sister?
Hey, how do I help you today?
I'm asking for a box of condoms.
Sisi, you were here yesterday. I gave you condoms.
But I
You
need
came
them.
back
I
again.
need them. I need them.
Sebeka.
How? I need them.
Are you selling
Are
condoms?
they not for free?
Ah, ulo khosha Sisi.
How, sissy? What kind of question is that? Don't treat me like that. I need a box. This. I need a box. Oh, sham.
Yes, sis, my little Nicole. Makhosha.
Akusashisi sekunjena ke mngani wami. Namhla kumnanzi akuva? Ah, strong. Hello my friend.
How, chomiam?
And then what's going on with you?
I'm very tired.
Ngathi unethi imvule.
Yeah, I'm sick of the nurses.
Uh-huh.
She called me bad names. Bega. Ungibelela nhloko. Wangehla.
Hayibo.
Ngemagama. Wehla ngemgogodlo bekutoba sawa ngabe bekukudla.
Who's that nurse?
Yes, sis. Angimathi ufake na into lengakalelingana neyami.
Nabo uyaphi?
Uthi ngisasweka. Naye mara ufana nami.
Nabo uyaphi kule clinic ngoba uyathi uthi bayenda njalo.
Benda. Sis.
Oh, kwathi wena?
Lokusalako noma ungasho njalo tova ngathi uyawathola lama condom
Mngani
ami.
wami phela nawe ubukene. Nginike one phela nawe.
Sorry, daddy. Ish, okay.
Man now, man.
Let me count.
How
Let me
now,
count
friend?
first. Let me count first.
Give me one, please, my friend. Oh, Shem, please give me one, my friend.
Wena.
Hey, what is happening? What's the rush?
Ish, sissy, you don't know. You don't even want to know.
You look sad. Were you
Ish,
crying?
I'm from the clinic.
And what happened?
Hey, I cried and cried and cried. Nyembe titam, tawam endleleni.
Why?
Yay, Lonas.
Yes.
Hey.
What did she do?
Yay, uyalathi ibhubezi malibona inyama ibaleka.
Okay.
No.
Don't worry, girls. Relax. This is going to be a thing of the past. I'm from Sisonke Sweat. Sisonke is a sex worker movement here in South Africa, which fight for the rights of sex workers and their needs, human and health rights for sex workers. So, Sisonke and Sweat wrote a proposal to NACOSA to offer services to sex workers. And NACOSA wrote a proposal to Global Fund to access funds to service sex workers. So, listen. So what is going to happen? We are going to have mobile vans. We are going to have HCT on our hotspots. You don't have to go anywhere. On your hotspots, they will come and give you services. STI screening, They'll give you condoms. They'll give us lubrications and everything we need, even ARVs if we need them, on our hotspots. Oh.
Is this the truth?
I'm telling you the truth.
Serious truth.
Yes. I'm telling
getting
you the
better.
truth. Yeah. Why should I lie? You are a sex worker just like me. We wear the same shoe size. So why should I lie?
Yes.
I'm also happy that you are going to get services.
Things are getting better.
Yes. I'm telling you, no way. Oh, here comes Nakosa. Hi.
How are you?
I'm good. How are you?
I'm fine.
Shem. I was waiting for you. I was telling my fellow sex workers about you.
I'm aware, as now, Kosa.
Yes.
Your proposal has been sent to Global Fund. You know what? I'm crossing fingers.
Yes.
Oh, I'm just crossing fingers that the Global Fund approve so that sex workers can have the funds.
No, that is what we are also looking forward to.
We're looking
and
for
we
that.
are also
But
counting
you know what?
on you.
Today I'm actually meeting with Global Fund. I just hope they've got the good news for us so that, we can have all that is listed in your proposal.
No, we are also looking forward to that.
Yo, look, there comes Global Fund with their proposal. I
Oh,
see an email coming
really,
through.
really?
I see an email coming through.
Hello.
Okay.
Hi, you the lady from Global Fund?
How are you?
Yes.
Yes, I am.
What are the good news?
Yes, the good news
Money,
is
money.
that we
What-
have
give me the money.
approved the proposal. And also, here is the money to support the service to the sex workers.
Celebrate! 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 Celebrate!
So we are going.
Viva CPC, viva!
Viva!
Viva Hlokomela, viva!
Viva!
Viva TPHI, viva!
Viva!
Viva Great, viva!
Viva!
Viva Munandinyi, viva!
Viva!
Viva free condoms, viva!
Viva!
Viva Tom!
Viva! RH, viva! Celebrate!
Celebrate, celebrate, celebrate.
Stop!
Ladies and gentlemen, I will come to tell my true story.
Yo.
I will tell you my true story today. I will come to tell you my true story today. Ladies and gentlemen, ke le ka hlelwa ke kotsi. Selemong sona senana ke a kgola ke kgwedi e fedileng. I will mix language. Sesotho, Xhosa, Sizulu. I'm sure it was Monday. The date it was 5 on Monday. It was early in the morning. After that, bekitsa ko ne ke tswa teng. After go ke boye ko ne ke tswa teng, ka be ke tlhakanile botho monso a khanang truck. So that guy, he was very disturbed me because it was late. Go go high in the selmtiar. Ki tswela mo ne ki tswela teng. So motho o a ba fitla a mpitsa. Ha tata o mpitsa. Ke hanne ka khola more than 15 minutes. Tsatsi sela le chabile. So that guy a ba mpitsa ngaya kuye sengibona nemehlo abantu ukuthi angibhekile. Ithe mangifika kuye wangibuza ibusiness nangu bungapi. Ngamtshela ngathi ebhudi uyasibona isikhathi lesi angisasebenza mina. Ido ngibani umuntu okutshela ukuthi ngiyathengisa mina. Hayi lo muntu wangilandelela lona ngala. Ithe mangicedile ngathi hayi nokuthi ngiyalo because amehlo abantu angibhekile ukhalisi utara. Ngithi ngibhekale lo muntu ukhalisi utara. Ngangena etruckeni. Wangibuza na kusebenza lwaphi ngamonisa. Ithe mangiceda ukumonisa isikhathi it was 5:45. Ithe mangifika lapho ke lo muntu lona wayengafuna wathi ngakhipha icondom. Ithe after ukuthi ngikhipha icondom wathi nangenzani ngecondom ngathi ngumsebenzi wami ukuthi mangenza ibusiness nomuntu ngifake icondom. Hayi lo muntu lona na nyani senza ibusiness sifake icondom. After isikhathi sesiya nga wathi hayi man ithi I can bring this condom that no wathi why ndathi no ngamuza ngathi yini into oyithele ebantwini ungafuna ukusebenzisa ikhondom azange angiphendule ngathi ebhuti yini oyithela ebantwini uqhube ilori wonke lo mhlaba wase-South Africa yini into oyithela ebantwini ungafuna ukusebenzisa ikhondom lo muntu azange angiphendule wavela wakhipha ikhondom kuye mangithi ngithi ngisabhekile wangishaya ithi mangithi ngithi ungishayile wathatha imali yami esikhwameni sami nale ebenginike yona ngafonela ngambheka nje ngakhonto ingekayenza kuye ngathi okay fine you can fight me I will be fine wangishaya wathi ngiphume emotweni yakhe ngaphuma emotweni yakhe ethe mangigqiba ukuphuma ngathatha nesihlango zami phansi ngafonela amaphoyisa isikhathi sesiyaphaya ngaboma 6:05 ithe mangithi ngifonela amaphoyisa athi kwi-even izawuza until lo muntu lo eronta apho kule ndawo besime kuyo wagqiba washiya imoto leyo abeyideliver lapho wahamba ndafanela ngoku ndiye police station after going in the police station labantu lebelapha police station kanti bayangazi ukuthi na yini engiyenzayo bangithathela i-private room after ukuthi bangithathela i-private room lo mnye wobhuti lona wangibuza kwenzekeleni ngamtshela ngathi ebhuti ngivelele inkinga kwenzeke into ukuthi itse hane ke reketsa business le motho o una sabatlo o mfostile huruma am fostile ke hanne ka makgatlo a fetang a 15 abele go motho na ke tsena ke dumela gore re etse business ke entse business le ene ha ke qetetse business le ene before ntse re etsa business ka fihla a ntsha condom kwa enya hae ha ka ta ntsha condom kwa enya hae ke a mo botsa ke a botuetsang hobaneng a re yana askise a re ha ba tlo sebedisa condom ka re mmotsa ka hobaneng o sa ba tlo sebedisa condom ke eng ntho e tshelang bathong because o khanna lori the whole South Africa ya ba strike sqala mo ya ba butona o ngodisa statement sa ka ya be le go masi idea manye a ntse tla ba sebeletsi ba molao ba ntse ba tla ka bongwe itse ba ntse ba tla ka bongwe ya be le gore ha ke qeta o tswa mo case number ya be le gore he before ke tla police station ke shootile lori eo ha ke qeta o shoot ka be ke tsamaya ke police station ke fihla ke ba bontsha ka nnete ba le ba e sheba ka tracker ba be ba e thola gore ke a mona Johannesburg na ke a o kae after that ka be ke tsamaya ha ke qeta o tswa ka gate police station ka case number e kena ha ke qeta o kena ka mora 3 days ba mfounela ha ba qeta o mfounela ba ke fihla ne bile ke tswa ke re ke ntsa tsela teng ba fihla ba mfounela ha ba mfounela ba re ba kopa ke tle police station ha ke fihla police station ke abuza ukuthi yini engizoyenza police station but umthetho uthi ufuna ukunivulela icala ngabuza icala elani lento engiyenzayo kathi ngeyiphi into engiyenzayo because ngizela police station ngizoreporta ngomuntu ongihlikumezile la estratweni ngizidlulela endleleni yena wangiforce so ngababuza ngathi why that day bengilana beninganibuzi lonto okanye niniqala ukuthi umthetho univulela icala azange bangiphendula bathi kunefomo elifanele ukuthi ngisayine mangiqeda ukuyisayina le form bathi izawuya ecourt mayibuya ecourt bazawuthumela lo muntu lo obambe case yami lo muntu lo wayeza kum wathi uyazi ngecase yami ngathi okay ngesikhathi senze istrike eside khona lapha police station ngafonela usisikhoni usisikhoni ke wanginikeze amanamba akasisonke wathi njengokuba uyimember yakasisonke you must call those numbers uzawufumana usisinomsa so I'm very 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 thank you.
Thank you. Thank
you very, very, thank you very much. Now that we've made it very real, may I ask all of us to rise and welcome Deputy President of the Republic of South Africa, Ntate Cyril Ramaphosa on stage. Ntate.
Thank you. We may be seated. Program Director, Deputy Minister Henrietta Bokopani Zulu, Deputy Minister of Health, Dr. Joe Patha, Ms. Steve Litseke, Co-Chairperson of SANAC, Dr. Gwen Ramokgopa, the Chairperson of the SANAC Trust, the CEO of SANAC, Dr. Farid Abdullah, Professor Sheila Tlo, the UNAIDS Regional Director, our MEC of Health, this province, and the acting mayor of this town, leaders of civil society and the sex worker sector, ladies and gentlemen, it is a real joy and a pleasure to have been invited to be at the launch of this plan. Now, Deputy Minister Bokopani Zulu, you've been talking about prepaid and pay-as-you-go. Now, as you know, with pay-as-you-go, sometimes people who do pay-as-you-go, they run out of airtime. Now, sometimes you have a dropped call as you are discussing something very important, and then you call them back if you are on contract, and you say, "What happened?" They say, "No, I ran out of airtime." Now, how does running out of airtime work with sex work?
That's running out of condoms.
She says that's running out of condoms. It could also be running out of steam. It is fitting that today we should be launching this National Sex Worker Sector Plan, this plan that has been so beautifully crafted and drafted and presented. It is a real plan. It's almost like when we launched the National Development Plan. This is the plan. It is good and fitting that we should launch it on Human Rights Month, for this is the month when our people in their struggle against oppression and exploitation, a struggle for human rights, got their struggle into top gear. And it is good that we are launching this plan on this day and in this month. We are launching this plan because this plan is about human rights. It is about the rights of ordinary people, ordinary South African. It is also about affirming the equal worth of every person. Sex workers, every South African, all of us included. This is about affirming our rights as well. It is about affirming the right of all South Africans to life, to dignity, to health, regardless of their occupation and regardless of their sexual orientation and regardless of their circumstances. This is a plan about public health. It is also about how we South Africans are able to demonstrate our care for all other South Africans. It is also a plan of how we express our solidarity. We launched this plan knowing our national effort is moving ahead in terms of arresting new HIV infections, that this effort that we have embarked upon will not succeed if sex workers are disempowered. It will not succeed if sex workers are ignored. It will not succeed if sex workers are neglected, if they are forgotten, disregarded, marginalized, and stigmatized. In launching this plan, we call on all sex workers to recognize the enormous power that they have in their hands in terms of helping our nation in making AIDS a thing of the past. This is your plan. This is a plan you must use. You have been involved in crafting this plan. So use this plan to help our nation to fight the scourge of HIV/AIDS. We cannot reclaim the morality of society by excluding the most vulnerable amongst us. Whatever views individuals might have about sex work, whatever beliefs that we might have about sex works, whatever the statutes that are on our law books might say about the legality of sex work, we cannot deny the humanity and the inalienable rights of people who engage in sex work. Sex work is essentially work as well. Sex work is a trade. It is work that is also recognized by our Constitution. Like anyone else, sex workers have dreams. They have customs. They have beliefs. They have a faith. They are human. They are just like all of us. As one of them was saying during the poetry, they also have blood flowing through their bodies, just like you and me. They too have mothers. They also have fathers, by the way. They have families, they have children, and they have all these people who love them and appreciate them as well. They have the right to be treated with dignity, the right to their bodily integrity, and they also have the right to say no. It has been almost 2 years since I became the chairperson of the South African National AIDS Council. In that time, I've had the privilege of working with a number of government departments, many people in government, a number of civil servants. I've had the privilege of working with many civil society leaders and members and their organizations, people who have been at the forefront of the struggle against HIV AIDS, and TB. And as I have interacted with them, I've come across some of the most committed people who are involved in the struggle against HIV and AIDS. They have impressed me immensely with their knowledge and deep knowledge and their total commitment in this struggle. I have come to appreciate how stigma continues to impede our country's response to these diseases. I've also come to learn that many men are still refusing to come forward to be tested and have treatment offered to them. I've heard how the financial challenges that a number of civil society organizations are facing impede their work, and they are therefore not able to mobilize the masses of our people because these civil society organizations live amongst our people. They are connected to the majority of people in the villages, in the townships, and all over else. I have come to hear that they face serious difficulties at a financial level. But they still remain committed to the cause. I have listened very carefully as the Minister of Health has spoken about how we can put 90% of people living with HIV on treatment and how we need to do so much more to tackle TB, particularly in the mines and in correctional services. In all this time, one of the issues that has been brought to my attention that has struck me as particularly perplexing, contradictory, and surprising is the matter of how one department of government, the Department of Health, has this great capacity to supply and distribute to sex workers condoms after condoms to protect them from HIV, to protect them from pregnancy, and to protect them from contracting sexually transmitted infections. And it is not uncommon at the same time to come across one other department of government acting in pursuit of law enforcement, going around arresting sex workers and confiscating the condoms that were distributed by one department. This has surprised me. And as South Africans, we must pause and think about this. The one department gives condoms, the other department takes condoms. And we need, in a very sober manner, to sit down and discuss precisely this dichotomy, because it is a contradiction in terms. And I would appeal that we should do so without much emotion. We should do so in a very sober manner and ask ourselves in dialogue and discussion, how can it be that two government departments are acting against one another around the lives of sex workers? So this is homework for all of us as South African. We have been unable to respond to the legal and social as well as health and the welfare in terms of the dimensions that affect sex workers in a very comprehensive manner. And we need to grasp the nettle and deal with this matter. We see this plan that we're launching today as a step that is going to enable us to deal with this matter in a very procedural manner. We have heard today that the rate of HIV among sex workers is among the highest we have seen in any community in our country. Frankly speaking, the rate of HIV among sex workers is quite alarming. But whilst it is alarming, what it does say to all of us that we have a responsibility to do something about it. With HIV prevalence rates 3 times to 4 times higher than amongst female sex workers than in women in the general population of their age group, we must realize that we are faced with a serious challenge that we cannot ignore. This is a very worrying situation. This is why SANAC, the body that combines a number of stakeholders in our country, has prioritized the prevention and treatment of HIV among sex workers. The development of an appropriate response does actually require reliable data. We are grateful to the United States Center of Disease Control and the University of California in San Francisco for conducting the first detailed study of HIV prevalence amongst female sex workers in South Africa. I was particularly pleased when I was introduced to our friends from the United States who come from the University of California, and we would like to applaud them for being amongst us and for having done this fantastic piece of work. The work that they have done has helped us to plan a national program that will eventually reach all sex workers in our country. I would like to thank the Technical Working Group, the Department of Health and Social Development and Justice, and various stakeholders, in particular the sex worker community, for working together to develop this national plan. This plan is informed by fundamental principles. It is informed by the principle that women and men who are involved in sex work must not be denied health services. They must not be denied information or advice. It is also informed by the principle that sex workers should not have to suffer and also die from diseases that are preventable, that are also treatable, and that affect all of us. It is informed by the principle that sex workers can no longer be denied their constitutional right. They can no longer be people who are just beaten up with no recourse to justice, or that they can just be subjected to unlawful arrest. In this, we are guided by the letter as well as the spirit of our Constitution, a Constitution which affirms the rights of all of us and the dignity of all of us without any exception. This plan is an innovative plan. It is a plan that is multi-layered, and it is also hugely comprehensive. At the center of this plan is a peer education program through which 1,000 peer educators will be recruited to provide support and assistance to around 70,000 sex workers over the next 3 years. As we heard, South Africa is one of the first countries in the whole world to take a decision to provide pre-exposure prophylaxis to sex workers. It will also be among those countries pioneering universal test and treatment for sex workers, whereby a person who tests positive for HIV will be offered treatment regardless of the CD4 count that they have. This plan goes beyond the provision of health services. And ladies and gentlemen, it is for this reason that we say the South African government is a caring government. It is for this reason that we say South Africa is a caring country. We are defined by our solidarity and our care for those who are vulnerable. The difficult issues of violence, the difficult issue of stigma, alcohol and drug abuse, depression, social isolation, forced migration, and also lack of economic opportunities are all addressed in this plan. This plan has left no stone unturned. We would like to see all national and provincial departments, as well as our municipalities and development partners, working together to implement this national plan. Earlier, when I entered here, I saw Andrew, my good comrade and friend Andrew. I met Andrew together with other colleagues earlier last month, and they raised the issue of getting our provinces to up their game in as far as their involvement in the SANAC work, particularly getting premiers of our provinces to be the real champions of fighting against HIV/AIDS and TB. Andrew, I'm pleased to inform you that I've just come out of a meeting with the premiers of our country as they were meeting in the presidential working group, and I passed on your message to them that we would like the premiers of our country, the mayors of our district municipalities, the mayors of our local municipalities to be the champions of HIV/AIDS and to be SANAC champions in the places where they work, and they must chair those AIDS councils at provincial, district, and municipality level. So your message has been passed on. And they have committed, Andrew, that they are going to take up their job seriously and become the champions. So I've executed what you asked me to do. This plan is critical because we know that the sex worker community is vulnerable and they're highly mobile. As this plan unfolds, we will need to deal with the legal status of sex work. We will also need to ensure that our laws balance the rights of individuals and the needs of our society as a whole. This should be an opportunity for all of us to get involved in a dialogue that is going to enable us as South Africans to discuss the challenges that we are going to have to grasp with, the challenges of how we deal with the legal status of sex workers, and also how our current laws are going to have to balance the interests of sex workers as well as the needs of society as a whole. As you have heard, this is the work which the government is engaged in. As it is now, the Law Commission has come out with a report, and this is going to kickstart a process of discussion and dialogue. This plan aims to sensitize healthcare providers, social workers, and law enforcement officials on the rights of sex workers to quality care, confidentiality, as well as the issue of consent. Consistent with our commitment to ensure that all South Africans have access to legal representation, SANAC has partnered with the Legal Aid South Africa, that is, to provide legal and paralegal support through a call center service to sex workers who are arrested. Let us today pledge to end discrimination against the vulnerable people in our society and to protect those who are involved in sex work. Let us pledge to end all forms of violence and discrimination against girls and women. let us pledge to develop sound policies, as well as to pass progressive laws that promote the human rights of all of us. This plan sets us on a journey. This is likely to become a difficult journey. It is likely to become a very noisy journey, a very boisterous journey, and it is not going to be an easy journey. There will be practical challenges that will need to be overcome, but we must make sure that we all participate in this journey with a great deal of courage and bravery. There are many complex legal and moral and social issues that we will need to grapple with. As we do so, we would do well to reflect on the wonderful words that were once said by Steve Biko when he said, "We have set out on a quest for true humanity, and somewhere on the distant horizon we can see the glittering prize. Let us march forth with courage, with determination, drawing our strength from our common plight and our brotherhood. May I add, which he didn't add then, our sisterhood. In time, we shall be in a position to bestow upon South Africa the greatest gift possible, a more human face." I want to read it again because it's quite a profound quotation. We have set out on a quest for true humanity, and somewhere on the distant horizon we can see the glittering prize. Let us march forth with courage and determination, drawing strength from our common plight and our brotherhood, and I add sisterhood. In time, we shall be in a position to bestow upon South Africa the greatest gift possible, a more human face. This plan calls upon us to embark on this journey. It calls upon us to recognize the rights of all of us, but in this case, the rights of sex workers. And I know that it is going to be difficult for many South Africans to embrace this notion of granting full rights to sex workers. It is going to be difficult. People are going to be confused. They are going to be questioning this process. But let me add quickly, the rights of sex workers are deeply embedded and deeply enshrined in our Constitution. They are inalienable rights. They have rights just as you and I have rights. As we embark on this journey, we need to recognize that sex workers in our country are vulnerable. They are vulnerable because they carry a huge disease burden. Almost 70% of them are carrying the HIV virus. And many of them are assaulted and victimized on an ongoing basis. They are stigmatized, and as South Africans, we need to take a stand and a view on this and say, sex workers have rights just as all of us have rights, and they should also be protected. That is what we should be saying. And in time, as we engage in this dialogue, discussing this very difficult matter, as Steve Biko said, we should and will be in a position to bestow upon our fellow citizens, sex workers, the greatest gift possible, a more human face that South Africa must bestow on them. And that is what we should show them. We should show them compassion, we should show them understanding, and we should show them the love that they deserve, because they too are people just like you and me. I want to end by inviting Kowali Buthelezi to come and stand right here next to me. Kowali Buthelezi is the leader of Sisonke, the national organization that represents sex workers in our country. I've called her here because as we embark on this journey of bestowing upon sex workers, who are people like all of us, as we bestow upon them our humanity, the face of humanity, as we move in that direction, I want us to bestow upon Koli and her colleagues who are sex workers our national flower and give this to them. So we bestow this upon you just to say we appreciate you, we love you, we embrace you. You are South Africans, just all of us are, and we respect you, and we hope that the laws of our country will also recognize you in time to come. Thank you very much. Thank you.
Thank you, thank you, thank you, thank you. Thank you very much, Deputy President. I say, let's settle, please. We are just a few minutes to finishing. So thank you very, very much, Deputy President, for the amazing words and for actually, in every agenda that government has to push, there needs to be a champion for it to happen, right? Right? So we thank the Deputy President as the chairperson of SANAC and the co-chair, Steve Letsike, who are going to lead all of us on behalf of yourselves to get to the destination that we want to arrive at. At this time, when everybody is just very decent and quiet, thank you very much, will allow me to call upon MMC for Health and Social Development, Nongeba Mulwela, to come and thank if she doesn't thank me, to thank, she must start with me. Thank all of us for being here. And once she's done, we'll just have a few announcements and closing remarks. And wow, we can go and party.
Thank you very much, Program Director. Your Excellency, Honorable Deputy President of the Republic of South Africa, Mr. Cyril Ramaphosa, the Deputy Minister of Health, Dr. Joe Pahla, the Deputy Minister of Social Development, who is also the Program Director today, Mrs. Henrietta Bohupane Zulu, the SANAC CEO, Dr. Farid Abdul, the Chairperson of SANAC Board of Trustees, Mrs. Gwen Ramokhopa, colleagues, ladies and gentlemen, good afternoon. Sanibonani. Program Director, allow me first to forward the apology of the Executive Mayor of Johannesburg, Councillor Parkstow, who loved to be part of us today, but could not make it due to council business. Hence, I am standing here. Okay, thank you. Program Director, I was saying, allow me to forward the apology for the Executive Mayor of the City of Johannesburg, Councillor Parkstow, who loved to be here, but because of council business, he could not make it. Hence, I am standing here as the acting mayor. Program Director, let me start by thanking the Deputy President, Honorable Cyril Ramaphosa, in his capacity as the chairperson of SANAC. Deputy President, there are not many political leaders anywhere in the world that are willing to provide leadership on the plight on sex workers, and so we particularly, as the city of Johannesburg, we particularly, Deputy President, as the city of Johannesburg, wishes to thank you for your unique brand of leadership, and indeed, you deserve a round of applause. Program Director, let me also thank our esteemed speakers who have spoken today. The Regional Director of UNAIDS, Professor Sheila, Ms. Kholi Buthelezi, who is the leader of the sex workers in the country. We have been with her in several HIV and AIDS conferences in the world. Dr. Farid Abdul, the Deputy Minister of Health, Dr. Joe Pahla, and also the vibrant Program Director of the day, Deputy Minister of Social Development, Mamu Henrietta Bohupane Zulu. Can we give her a round of applause? Ladies and gentlemen, the production of the National Sex Worker HIV Plan is a result of the work of many organizations and individuals over many years. It could not have been possible, Program Director, without the dedication, the leadership, and resources provided by a number of people, some of them who are not necessarily in this room. First and foremost, we would like to acknowledge the dedication and bravery of sex worker advocacy group. Please give yourself a round of applause. The advocacy group have contributed not only to the development of this plan, but who continue to drive the conversation on the rights of sex workers. As the Deputy President has emphasized in his address this afternoon, the national plan that has been launched here today gives equal importance to the constitutional and human rights of sex workers as it does to the public health rights. Then, a special vote of thanks must go to Dr. Gwen Ramokgopa, the chairperson of SANAC Board of Trustees, as well as the technical working group and the SANAC secretariat staff who contributed a substantial amount of time and effort into the development of the plan and the preparation of the launch today. Special thanks must go to the steering committee of this group, of the technical working group. Thank you for keeping the process on track when differences emerged in the technical working group and steering this process to where we are today. Program Director, let me also acknowledge the strong financial commitment such as that which is already provided by the National Department of Health's High Transmission Area Program, the Global Fund, and PEPFAR. These resources, Program Director, will go a long way in achieving the ambitious targets set out in the South African National Sex Workers HIV Plan. Special thanks go to the Minister of Health, Honorable Dr. Aaron Mutwaledi, the DG, Ms. Malibona Matsoso, and Dr. Jorgen Pillay, Deputy Director General in the National Department of Health, for their leadership, guidance, and encouragement during the development and launch of this plan. And finally, ladies and gentlemen, let me thank the Deputy President and his team, who worked so closely and with such commitment to making sure this plan becomes a reality. Also special thanks to Dr. Abdullah and the team at the Secretariat, who made both the preparations of the plan and the launch a reality. Lastly, I would like to thank members of the media and all the stakeholders who participated in the event today. We know that with your presence, members of the media, the message will spread, and a positive message, a good story to tell. You will agree the final applause must go to the sex workers. I must say that sex workers, today, you have been brave and strong and have made your presence felt in the company of all dignitaries that are present and those that are not present today. I think you have done us proud. With your participation, we will indeed take forward or move forward our country. To the Deputy President, Ugwanda Gwaliwa ngumthakathi. Sibamba ngazibini, Ndorebwa ngamanda. I thank you.
Thank you very much, Nongeba. To all of us, Deputy President, Deputy Minister of Health, the CEOs of the different civil society organizations, the regional director, the co-chair of SANAC, and all of us as sex workers. Allow me to say that this is the beginning of a very long and windy road. We've walked up to here. We've not arrived at our destination. Together, all of us as South Africans, we remain committed to creating a South Africa that belongs to all of us who live in it. Deputy President, we have the energy as sex workers to walk the miles that will be required, the commitment that will be required, and of course the explanations that we will have to give. We remember 1996, we started the journey, actually 1994, and we got to 96, where we passed the termination of pregnancy as the ANC-led government, affirming the right for women to choose. And we walked the mile again, as our constitution requires, where we ensured that we acknowledged civil marriages, same-sex marriages. It was a long journey. And here we are again as a nation, reflecting and providing the leadership role in launching this program. And once again, we will scream at each other, we will explain ourselves, but as the ANC-led government leading South Africa, and as we say this year, advancing the people's power, we remain committed to making the lives of sex workers different. With those words, I hope that we are ready, we have the stamina and the energy to get to the destination we've set for ourselves. Thank you very, very much for having listened to me and bestowed the honor to direct this program. You've been an amazing, amazing audience. And let's go and be safe and have lots and lots of very, very safe sex. Good night. May you please allow me to request the Deputy President to excuse himself before we all jump up, and followed by the rest of the table. And as I said, all of us can start the party. Thank you. Okay, thank you very much. Can I please, hello? Can I ask the members of the media to move to the room next door for the press briefing? The room next door for the press briefing, please. Thank you.